It's just taking me a minute to set it up. Do you have your ringer off on your cell phone?
Oh.
Just so it doesn't ring. What do I have to do? Mine is here. Oh my gosh. I don't know. Why don't we just put it in another room? Put it in the bathroom and close the door. I don't know how to work your phone.
Okay.
Okay, wait a sec. I'm just getting ready to go in. Okay, I'm clicking the button. Are you ready?
I'm ready.
Well, hello everybody. It is Friday afternoon and welcome to a different kind of better. So I've been excited about this talk all day today, and I cannot tell you how pleased I am to have this amazing guest speaker. She is actually going to tell you a little bit about her background herself, but I can tell you that she actually has 11 initials after her name. 11 initials, that's pretty impressive. So I think I would say that she's an expert on this topic. So I just want to let you know that today we are talking about an issue that a lot of ladies have, and I'm one of them. So don't be worried to ask us any questions. You can private message us after this meeting. We'll get the information out to you. But we're talking about, you know, being a little bit bigger on the bottom than you are on the top. It's a condition that a lot of ladies have, and our guest speaker Cindy Knight today is going to tell you everything you need to know about it. So with that, I'm going to introduce you to Cindy and let her tell you a bit about her background and how she started working with this issue, and then I'm going to ask her some questions, and hopefully we'll get to get to answer everything that you could possibly need to know all about this condition. So Cindy, go ahead. Thank you for coming on today, by the way.
Good afternoon, everybody. And thank you, Lynn, for inviting me to join you today and talk about Feel Better therapies. In the mid-90s, when I was nearing the end of my 32-year career with 3M Canada, I was experiencing some serious digestive issues. Part of the problem was that while my husband and I were doing what we thought was living the good life, I had gained weight, and I now weighed 157 pounds. That was a lot of weight for a 4'11" girl. I had tried diets that didn't seem to work, and finally I made an appointment with a holistic nutritionist. He asked me a lot of questions, and then he had a blood type sample taken from me and shipped it off to a lab in the US where they did the blood type testing, something I had never heard of. They came back to me with a list of foods that I could have and a list of foods that were a no-no for my blood type. When I started following the instructions, I lost 1 pound a week for 47 weeks. Every Saturday morning I would get on the scales and wow, I'd lost another pound. I mean, who in their right mind would celebrate losing 1 pound? But I had 47 celebrations. And so when I started following the instructions, I decided to stay on the instructions, okay? And I have maintained the proper weight for 25 years. When I retired from 3M in 2001, I enrolled in the Canadian School of Natural Nutrition and became a registered holistic nutritionist. and open my own holistic practice, because I realized that there were a lot of women out there that had the same kind of problems I had had, and it would be kind of nice to have a purpose and help other people with their wellness. Over the years, I've added other holistic services that I now specialize in 4 services that complement each other and have provided clients with the help they need to improve their wellness and their purpose in life. A few years ago, I met a lady named Sherry who helps self-employed ladies in business through her networking organizations. She contacted me and made an appointment for the Ion Detox foot bath that I had started providing my clients in 2004. Her doctor had told her that she in 5 years, she would probably be in a wheelchair because she had symptoms that are common with something called lipedema. I mean, I had never heard of it, but we started her on a detoxing program, and I also referred her to a lady who does lymphatic massage. And over the next few years, Sherry's situation improved, and because combining these services made it possible for Sherry to forget about ever ending up in that wheelchair. This motivated her to head up the Lipedema Network of Canada and develop a program for ladies with lipedema symptoms to benefit from the services that I provided for her. The wellness room where we provide these services to ladies is located at 904 Oxford Street East, inside Nature's Hub in London.
Wow, that's way better than I could have introduced you, Cindy. Thank you so much for that. So basically, I guess we're going to start with asking some generalized questions. And I think, you know, you mentioned the word lipedema, and I remember the first time that I heard that word. Uh, you know, I have a medical background, so I can break down words and understand what the meanings are. But for most lay people, it's what the heck is that? And so basically, maybe what can you tell us? What actually is lipedema?
Okay, well, lipedema is a misunderstood and misdiagnosed chronic adipose tissue that occurs almost exclusively in women and manifests during times of hormonal changes as symmetrical buildup of painful fat and swelling in the limbs, sparing the hands and the feet.
So basically you're saying what I'm saying is that most of the time this condition will show itself in the bottom half of the body.
Oh, yes, yes. Yeah.
So these are, it's more related to people that are generally sort of, you know, gaining their weight all over. There's a definite difference between just generalized weight gain and lipedema.
Oh, for sure, for sure.
So how many people suffer from this? Is, you know, is there a large percentage of the population that walk around with this that maybe don't even know that they have it?
Well, our latest studies show us that 11% of the female population in the world suffers from this painful fat syndrome, as well as a very small percentage of men, but it's mostly women.
Yes, us poor women. So tell me, what does it feel like? How
Well,
does
I
it
asked
feel?
Sherry, who is now the Lipedema Network Canada president, this question, and this was her reply. So let me just read what she sent me. She said, "It's very painful. My 8-pound dog jumps upon my legs and I wince in pain. My legs throb constantly, especially in the evening. My legs are so heavy to carry around. In fact, it feels like my legs are filled with cement. I'm exhausted at the end of every day. It also feels hopeless sometimes, although I keep very optimistic. I have been blessed to have found help and support to slow down the progression and manage the disease. Although it's rigorous work, I must eat properly, stay very active. I have regular manual lymph drainage massage and detox foot baths to keep my pain level down to a point I can endure it and be able to pick my feet up off of the floor."
So that's, you know, it kind of makes me feel sad because that, you know, I couldn't imagine having to live every day with
No,
those
no.
that kind of symptoms. And I think a lot of people with a lot of different diagnoses, they walk around every day suffering. And, you know, some of them will just take pain medications, right? They will just hide the pain, give themselves temporary relief.
Yeah.
And what they don't do is seek out something that could actually help, maybe not cure them, but actually minimize their pain, right?
Right.
Um, so, so do you have an idea as to what causes it, Cindy?
Well, there is no known cause, but experts suspect hormonal causes. Lipedema begins or worsens at either puberty, during pregnancy, following a gynecologic surgery, or at the time of menopause. So we think that the susceptibility to lipedema also appears to be genetic because mothers and daughters will have lipedema.
Wow.
Yeah, wow is right. Yeah.
So how can you tell? How do you know if you have lipedema? Like, there must be some subtle differences, right? That are apparent.
Well, there are actually. One of the signs of lipedema is something called a negative stemmer sign. If you can pinch a skin fold at the base of the toe or a finger, then this is a negative stemmer sign. In lipedema, the stemmer sign will always be negative. In contrast to lipedema, to lymphedema, lipedema is always symmetrical. Lipedema is painful to pressure and touch. In the advanced stages, even wearing tight clothing is painful. When ladies with lipedema come to see us at the clinic and I get permission to touch them, I find that there's little lumps underneath the skin that feel like little rocks. And that's one of the things that we know is a connection with lipedema. Some of the more clinical signs are pain from touch and pressure, bursting or throbbing pain, often spider veins on the outside of the thigh. Like we don't have a lot of veins on the inside of the thigh, but they'll be on the outside of the thigh. Severe susceptibility to bruising. And as I mentioned, a family history, mothers and daughters may have it. Increased swelling of the calf in the second half of the day. Skin is soft, nodular, and exhibits typical pitting. That's what I meant about feeling like little stones under the skin. And in a few cases, the arms are also effective. And when you look at ladies' legs, the ladies that have the lymphedema symptoms and look at their legs, when it gets down to the ankle, it's like there's a cuff at the ankle. And there's a presence of fatty nodules. They just can't be avoided. So these are the things that when ladies come to see us, this is we look at to see if they are having lipedema symptoms.
So, Cindy, I'm going to be totally honest. Most of the people that know me, yes, I'm a natural healthcare practitioner. I've been doing that since 1996. However, I do want to say I've never had somebody come in my clinic and see me for lipedema. But now that this is, I've been made aware of this, it makes me realize that maybe we just aren't asking the right questions. And I know for a fact that I've never seen it as a medical diagnosis. So that tells me that, not a lot of physicians are aware of it. So why don't more doctors know about this?
That's a good question. Although lipedema was first described in the 1940s, many healthcare practitioners are not aware of this disease in Canada. It's not taught in medical school, so there are few who can even diagnose it in Canada. Despite its description in 1940 by Allen and Hines, little is known about this condition, and few physicians recognize the signs and symptoms to properly diagnose it.
Mm-hmm. Yeah, that makes total sense to me. And, and I think nutrition is, not quite there for a lot of the physicians. I know they have a basic understanding, but I've said this multiple times. I wish they would get more on that, but then that's why they have people like us, right? To sort of help them along those lines with alternative nutrition. And so I think I know a couple of people actually that may actually be suffering from this condition. And and I know that they've tried every single diet on the planet and nothing nothing works for them. Like you know, they've done the cabbage soup diet, they've done the keto diet, they've done the intermittent fasting diet,
Yeah.
and which are great things and work for a lot of people. But I think for this type of condition, it just doesn't seem to get them to where they need to go.
Mhm.
So do you must have an idea, you know, with your background, especially, you know, your degree in nutrition and things like that. um, why does dieting not work for these people?
Well, it's interesting. The fat of lipedema is metabolically different from other fat. So that's one of the main reasons. It's the hormone-dependent subcutaneous fat that's affected by lipedema. And this type of adipose tissue is very resistant to weight loss. Even though dieting and exercise will not reduce the fat involved in lipedema, it's still important for ladies to do dieting and exercise to keep them from gaining weight on the rest of their body. It's still vital to do those things because they help you lose weight from the non-lipedema fat and reduces the inflammation. This is one of the things we teach the women who come for support. And I'll talk a little bit about the diet that we recommend to ladies in a few minutes.
So tell me and, you know, hundreds of thousands of other women would like to know, is there a cure?
There is no cure for lipedema. But there are certain things that one can do to slow down the progression, such as the ones that Sherry mentioned that we offer in the wellness room. Surgery. Surgery is an option, but carries risks and is not a cure. And sometimes ladies will come to us and ask us what our opinion is of surgery. And we have to tell them it's an option, but it's not a cure.
Sorry, my mute button did not want to work. So how do you find people take that? I mean, they must, you know, they must be sad that to know that this is a condition that is going to be with them for most of their life. But in the same token, they, I'm sure that, you know, with what you're offering them as support, you're giving them some hope that, you know, things can get better, that they can live with less pain. They don't need to feel as helpless and so desperate. So what kind of support does your clinic offer these women, or you yourself? How does that work?
Well, you're right about women feeling helpless and desperate because they do. Women with lipedema are left to suffer the gauntlet of medical mystery, the judgment of family, friends, physicians, and strangers alike. Far too often, the women who suffer from lipedema are told that their leg growth and swelling is a result of their inability to control their diet or their sedentary lifestyle. Patients with lipedema are frequently questioned about their compliance with diet and exercise recommendation. As a result of a fixation on their increasing weight and growing body habits, coupled with the fat shaming, which runs rampant in society today, women with lipedema frequently suffer from significant psychological, psychosocial distress, including anxiety, depression, eating disorders, and isolation. We all believe that self-esteem related to body proportions really needs to be restored, as does self-confidence in finding what is the matter with my legs and what is it I can do to help myself through education and healthy choices.
So Cindy, you know, we've talked about lipedema, and I'm not sure that people have a really good understanding of what it looks like. And I know you've given me a couple of pictures, and I'm hoping and assuming that this particular person is, you know, okay with us showing
Yes,
these pictures.
yes, please
And
show.
I'm hoping that it'll work, that you can actually see it. So
Yeah, hold it up a little bit higher, and you'll see that there's swelling at the top of the leg and then over the knee, but the swelling stops at the bottom where I mentioned the cuff at the ankle. Okay, now this is an early stage. This woman hasn't had these symptoms for very long. We have another one though that's far more advanced. If you wouldn't mind showing that picture,
okay.
Lynn. This one is this one lady has a lot more pain and a lot more suffering than those who have it just in the beginning. She's had this for some time. Okay.
So when you look at these pictures, and I'm sure the viewers now and in the future, some of these will look at these and go, well, like that's my legs too, but how do I know if it's lipedema? So the main thing is that when they touch their legs, it's painful. And I'm just reiterating. And secondly, that sometimes they can feel these small nodules underneath the surface. Um, am I right in that?
Yep, yep. Well, at the wellness room, we offer a lipedema discovery session that women can book. And if we feel they have lipedema, upon commitment and agreement to enter our Living with Lipedema program, we then have the opportunity to discuss with a medical doctor the client's entry status, what they look like, their status when we first met them. With ongoing commitment, we also have the ability of having an overview of our plan and suggestions. For example, there may be a need for a lipid profile, other blood tests, or bioimpedance analysis, even body composition assessment, including body mass index. So these studies are available.
Mm-hmm.
We also offer a 4-part program called Living with Lipedema to help women get educated and set some goals for themselves in regards to self-care and life choices, choices that they need to make so they can indeed live in their best life with lipedema. Every time the woman comes to see us, they get a detox foot bath, 10 minutes on the magnetic energy mat to help manage pain, and balancing the body with color therapy. So at the first session, we ask the client to check off a list of symptoms that they are dealing with. Then the client spends 10 minutes exposed to magnetic energy. The magnetic energy mat or pillow, and I think you have a picture of that, Lynn, if you would show it for me while I describe it. It
Oh,
comes
I
as,
do. I have
yeah.
it. Bear
Oh,
with
good,
me.
good.
Sorry for
It
lives.
comes,
Really?
there it is. It comes as a big mat that lays on a massage table or a smaller pillow that can sit in a chair. And we find the ladies with lipedema symptoms really prefer the sitting in the chair rather than worrying about balancing and getting up on that massage table. It uses pulse electromagnetic field energy to send natural impulses like those of the magnetic field of the earth to each of our cells, so cells can repair themselves and the body can produce new cells. Time on the mat reduces pain and inflammation. It reduces the effects of stress on the body. It improves the energy and circulation, and it starts the detox process and balances the immune system, as well as relaxing muscles and improving mobility. So this is an ideal way to start a detox session. The only people who can't use this are ladies who are pregnant or suffer from epilepsy or have electronic implants. So 10 minutes on either the mat or the pillow begins the detox process that will clear toxins from the cells and the tissues and reduce the pain ladies with lipedema symptoms deal with 100% of the time. Okay, so that's the first thing we do. The next thing the client experiences is that ion detox foot bath. It's a safe, effective way to help your body detoxify naturally. Toxins that build up in the body are left to be cleaned up by the blood, lymphatic system, and vital organs. Those which cannot be cleaned up attach themselves wherever they can to the tissues. The acidic toxins then may build up in the fat cells, in the joints, especially in the muscles and even the organs such as the liver and the kidneys. So the ionizer helps to eliminate these toxins by allowing them to escape through a unique process called osmosis. The foot bath ionizer uses water as the conductive medium, and the toxins exit through the 2,000 pores in the feet by a process we know as osmosis. Finally, the detox session ends with color therapy. The color therapy that I use to rebalance the body is applied to the feet with a color light wand that was invented by a Dr. Peter Mandel in Germany many years ago. He found that light impacts the organs and balances our chakras. So based on the foot bath water, we have an idea which body parts are detoxing, and the approximate color can be shown, appropriate color can be shown on the feet and the hands to rebalance where the toxins were removed from. When Sherry was explaining her experience with lipedema, she mentioned diet. When I took the lipedema course from the University of Arizona a year ago, foods that need to be consumed and those that should never be consumed were discussed, and they provided a list. Because I am already a nutritionist, the nutrition consultations I provide then are based on a combination of information from eating right for your blood type, proper food combining, and the information provided by the University of Arizona for the lipedema course. The consultation provides identifying the symptoms and how then to recommend the foods that will support the body and the digestive system. We are so happy to be able to help ladies when they come to us with their issues. And these are the 4 things that we do when we see them. And we put them on a four-week program to move this forward gradually and watch them progress and improve.
Wow, Cindy, that was, you know, a lot of information, but I'm sure that there's a ton of people out there that are going to benefit from hearing this today. You know, I know you said 11% of the population, but you know, when you think of how large the population is, that's an incredible amount of people that could use this information.
For
So we're
sure.
hoping if, you know, if you're viewing this today, that you'll share this live video on this very important topic, get it out there so that we can help as many ladies that are, you know, dealing with this issue on a daily basis. I can't thank you enough for sharing this information with us today. Just remember, if you would like to get hold of Cindy at Nature's Hub in London, Ontario, Canada, because this does go out globally, the phone number is 519-501-0685. And on that note, we're almost at the end of our live here today, but I do want to mention that this platform is an education platform. A different kind of better is to educate the world, hopefully, on topics that people are having, you know, considerable difficulty getting help with. We are looking for practitioners that, like ourselves, like Cindy and myself, that want to help, that want to come on, do a live talk about their modality, their willingness to help others on a global basis. A lot of this can be done with virtual technology nowadays. You can learn virtually, especially, you know, we learned a lot about this during our lockdown recently. So we can still help a lot of people out there, and our goal and mission is to get the word out. So help us get the word out. If you are a wellness practitioner, please go and check out our site at adifferentkindofbetter.com. Become a member of our site. It's $20 a year to have your practice in the directory. It gives you an opportunity to be heard, to help people, you know, as much as possible. We want people to know that there is a different kind of better, that we don't always have to rely on medications to get us through the day, that there is a lot of people out there, that we are not in competition with each other. We want to promote each other, lift each other up, and help as many people as we can. So check us out at differentkindofbetter.com. All the wellness practitioners or anybody out there that has a story to tell us, that, you know, that they had this condition and this is what they did and this helped them. We want to hear from you. So with that, we're wishing you a truly wonderful weekend. We're going into a beautiful weekend this weekend. We hope that it's nice and sunny. It's cloudy today in our area, but we hope that the sun comes out and shines on you and brings you a lot of bright light and happiness. Thank you so much, Cindy, for joining us today. Thank you to our viewers for coming and joining us joining in on us. And we hope to see you every Friday at 5 with some awesome topics that are going to help a lot of people. Take care. Have a great weekend. Bye for now. Thank you.